Good morning, everybody. Thank you very much for joining us today. Purpose was really jumping on the call today just to walk you through the new updates that are coming out in the next few weeks, deployed on September 1st, and really just to give you a bit of an overview of where we're headed over the next 4 to 6 months. Before we jump into that, really just at a high level view, just to kind of drill down on exactly what we do here. Fundamentally, Rxtro, the way we look at things is that we're connecting GPs with obviously the most up-to-date clinical information. The way we break this down is that on one side, you have 27 million patients that are going in to see 30,000 GPs who are essentially responsible for diverting them through the broader healthcare system. And this can be 40,000 specialists, 4,000 pharma industry, 100,000 allied health professionals, and obviously pathology, medical imaging, and hospitals. The way this is done is via a variety of different means. So there's obviously meet and greets, there's in-clinic CPD education, there's people out there running patient recalls, and really what we're looking at over the next few months is how do we obviously articulate this value that is being brought a lot better to the primary care audience and really kind of showcase what it is that a lot of people have to offer. So the good news is, look, we're continuing to grow. The big gauge of this is obviously what does the availability look like in terms of the system. Once again, up till August this year, more appointments available than ever has been. So 206,000 individual appointment slots made available on an annual basis via the system. These are often group meetings, so 3 to 4 doctors in attendance at each. So another way to look at it, potentially 6 to 800,000 potential interactions out there to showcase exactly what you guys were doing. So as I say, really what we're going through today is the changes that you'll see in the system deployed on September 1st. So what I'll do, I'll jump into the system and we'll walk you through things. Fantastic. The big change that you'll see in terms of the system, firstly, what we've done is we've renovated the future appointments section. You might have noticed that the My Customers and so forth have been migrating from the old table formats to a newer version, a lot more user-friendly, really a lot of design elements put into it to essentially make sure that you're getting all the right information. What you can see, we've got a new rolling piece at the top which showcases that availability, so you can see exactly what appointments are available in the different states, and essentially your future appointments now is broken down into 2 screens. What you'll see on the second tab now is that you've got future appointments where you haven't as yet added the meeting details. So what you can see is that basically it's a new look card, so the information is a lot clearer. You've got the time and date, the status of the appointment, whether it's a group or an individual meeting, and obviously the details are a lot more clear. Essentially, the other feature that's been added is the ability to search. So if you're looking for a particular appointment, you can type this into the search field and really quickly and easily understand where it is that appointment's at. And you can also see different colleagues that are in your team as well. The big change that's coming on September 1st is that you'll have the ability to add meeting details. So historically, the appointments were booked. The details that were provided were often the person who booked it, where they're from. What you'll be able to do now is complete this information, and essentially you'll be able to add in these 3 different elements to the type of meeting that you're planning on having. We've done a lot of work with the wide variety of people on the system over the last sort of 3 to 6 months to really make sure that the content that they were looking to add is an appropriate style form. And really what we've fundamentally broken it down into is people are generally dealing with either a practitioner who's coming to visit the practice, they're looking to run a program of some sort, they're looking to discuss products, or potentially the latest edition that will be deployed on September 1st is the facilities form. So this is where I'm talking about a building, which might be a radiology practice or a pathology practice, or potentially even a hospital building. So when I add the meeting details, I can say, yes, I want to discuss these products, or I might be delivering this program. I can pop the details into here. Click on save. And what will happen now is that appointment will appear in my future appointments sections, confirmed, made with the meeting details. When I click on view more meeting details, I'll now get a comprehensive card that summarizes the information. One of the big changes that we've made is historically there were attendances shown in terms of percentages. You'll now have that indicated on a likelihood scale. So these doctors are likely to attend, these doctors are unlikely to attend, so that obviously you can plan your day accordingly. The other big update that we've put in is really made the free text practice notes that a lot of the buildings put in a lot more visible. So as you can see here, this example, this particular doctor prefers to see only reps with skin related products. So once again, giving you all the information that you need in order to make sure that you're using your time as effectively as possible. And then they've got that content detail there in terms of that. So as I say, once the appointment's made, essentially around sort of 7 days out, you'll be prompted to add in the meeting details, at which time it'll become a confirmed appointment, ready to go. What I'll do now is I'll walk you through the full workflow in terms of booking and appointments, just to show you sort of the key things that have changed, and importantly, the key things that are remaining the same. So in terms of booking an appointment, I click on the My Customers tab, the same as I always have. So I need to jump into, oh, I'm in the staging environment, so jump into the production environment. Oh, apologies, I had about a million different tabs open over here. Let me jump into the production environment. Okay. So essentially, what will happen, the changes on the My Bookings that are there at the moment since we've last spoken to everybody, essentially what I can see is that now under the options, I've got the ability to view the appointment schedules that are made available. What you'll see is that you'll see the type of appointment slot that's been made available. So you'll see that certain ones are restricted to CPD content only, and essentially you can see all of that. So we click on book. Okay, I can see the availability. I then click on take appointment. What you'll see in the system now as well is that we've added in the weekly planner. So this gives you an overview of the other bookings that you've got in that week, to ensure that obviously you aren't planning on being on the other side of town on the same day. Once you click on book, the only change that you'll see is now that on the My Appointments section, essentially it'll now appear firstly under the future appointments without details, where you can go through that process of obviously adding those things in. So that's the workflow to get the appointments booked. The obvious question is, how do we manage those details around the products, people and facilities? If you log into your system now live in production, apologies, the challenges with live demos. If you log into your system live, what you'll see is that there's an additional tab that's now available. It's called the Products and Services tab. And essentially there's these 5 different options, and My Facilities has only just been deployed today. So what I'll do is I'll just go through the products section first. So essentially when you create a product, the details around the product are as follows. So obviously you can put in a picture. When it comes to displaying this to the practice, obviously pictures always make things look a lot more professional. But fundamentally what it's asking is the name of the product, the ATC code of the product, the Australian approved name. And the important thing is what the system's trying to get a bit of an understanding of is this a new product? Is it a new indication? Is it a new NOP listing? Or is it none of the above? We're then looking at the therapy area. The system supports all the different types of products that we've come across. So this is vaccines, pharmaceutical products, sunscreens, medical foods, and obviously depending on what I was selecting this section will depend on the prescription status and the schedules that apply. So obviously with medical devices, we're looking at classes, and with products, we're looking at schedules. The system does support products that are not TGA registered as well. So this is all the vape products, the medicinal cannabises. We've got, obviously, is it listed on the PBS, special access scheme or authorised prescriber. So you can put all of that detail in there. The brief overview is a free text field that you can populate, completely up to you what you'd like to put in there. It is optional. If you want to leave it blank, once again, up to you guys. Finally, you've got the URL to the full product information. And once that's created, you'll see that it'll appear in the product list. So this only needs to be done once. The products are also set up at a team level. So essentially, if one person within the team does that, then they'll be there as a selection for everybody. The other options that we've got, and a really important one that's just been deployed today that has been coming up quite a bit, is we have the ability to add a healthcare facility. So the healthcare facility essentially the details that we're looking at with this. So this would be a radiology practice, a pathology practice, a private hospital. So obviously the parent company would be linked to the parent organisation that you're a part of. And then essentially you would put the individual hospital name or the individual radiology site. You can put in the address. We've added an option to put a MAPS link, a phone number, and a description. And then obviously the opening hours. So a lot of flexibility with this. You can say weekdays 9 to 5, Saturday mornings, or obviously you can say open 24 hours and just keep adding additional entries. Services provided obviously has an emergency or not. But what you can do is you can go down and select different specialties. So for example, does the facility have maternity? Does it have radiology? And essentially keep going. So if this was a radiology department, sport and exercise medicine, and then underneath sport and exercise medicine, what are the specific areas that are looked after and what are the specific treatments that are offered? Is there an MRI machine or is there not? Does this place do heart transplants or do they not? So the flexibility to obviously do products, facilities. There's also practitioners and programs. Within the practitioners section, this would be an example where a typical small private specialty group, there's a lot of changes that we're focused on bringing into this section. Once again, the details that are asked for this one, basically you click on next, you can capture the practitioner's name, the area of practice, conditions treated, practices, and what's a really exciting thing that's coming very, very soon is obviously the booking system that you use at your practice. We're building into the system at the moment the ability to actually surface your availability so that in the future you can actually receive bookings directly from general practice for your patients. So instead of needing to get out as often and obviously drive those referrals, you can do that in that sense. You can obviously add additional optional details. You can put in a bio and then essentially you can manage those details in there. The final piece to add in, and this is one that we're seeing is driving more and more adoption. What we're seeing from practices is that they're prepared to make different times according to different content types. So your typical sort of meet and greet interaction, this is where you might go. It's generally in between sessions. It might be 12 o'clock, 1 o'clock, 2 o'clock. And fundamentally, the style of interaction is it's probably 15 minutes at the most, and it's generally sort of one after the other for those quick updates and those quick meet and greets. There are a lot of people on the system who are capable and willing to deliver more comprehensive and more robust discussion and obviously education in these areas. Essentially, what the purpose of this is to set up times with the practice where they're actually ready for that as well. So what we're seeing is that the practices in these situations might be making 5:30 in the afternoon, they might be making 10:30 on a Saturday morning, but fundamentally the attitude towards it is that everybody will be in attendance and it'll probably be a full hour of interaction. What this is aimed at is basically what that looks like in terms of the content. So this is obviously content that can be used by the GPs for their ongoing professional development. And what you'd populate in this section is obviously where does this content sit in terms of, is it an educational facility? Is it around measuring outcomes? Is it a mini audit? Is it a process like that? Or is it reviewing performance? Or is it a combination of all three? Who is it aimed at? Is it accredited? So there's a lot of accredited activities out there. There's also the ability to deliver non-accredited pieces. Sometimes, particularly with a lot of the specialty groups that we're working with, keeping that reactivity or responsiveness to exactly what the GPs are asking for in terms of their areas of education means that sometimes it's not the case of sort of going down the formal accreditation process, but fundamentally through peer-to-peer based learning, the specialist can absolutely come out and discuss a particular area or specific topic. We're looking at the delivery mode and format. What's interesting, and this is kind of the real area that's sort of building within the system. At the moment, the most predominant channel that Rxtro is used for is obviously the face-to-face channel, so somebody actually driving out and attending a particular practice. What we're seeing obviously with these high value activities is that there is more of an appetite to potentially do a remote or even sort of a hybrid based activity. So it might be a case of, yes, I'm booked in, I'm coming out there on the 14th. Prior to this, I need you to obviously identify 4 or 5 patients that meet this criteria. Prior to this, I need you to complete this online educational activity, because the piece that I'm going to be delivering face to face is a measuring objectives section, but we really need to have had that EA section done prior. So really opening up a lot of formats for that. Obviously, in order for the GP to be able to use this for their professional development, they need to understand it needs to be structured in terms of obviously what the key need or skill gap that this education is addressing. What are the learning outcomes? So what are basically they're going to achieve at the end of it that they didn't know before? And how is the activity structured to deliver those learning outcomes, and how is that ongoing improvement process around feedback to really make sure that it is achieving those particular outcomes. So fundamentally, you can create these programs in the system, you can book the different appointment types, and you can add them in to the piece. What I'll just finish with before I open up to any questions is really the events section. So this is a little bit different to the rest of the changes in the system. So fundamentally, the rest of the changes are, yes, I'm booking in an appointment and I'm coming out there and I aim to deliver this particular product or this particular program. Really what the events are the opposite of that, whereby the events activities where you're asking the doctors to either attend in a physical location or attend in a remote-based capacity. The events form is really, really flexible. So essentially the way it works, it obviously captures the name of the event. You can add a header picture, the discipline or the topic that it's looking after, and what are the key topics that it's focused on. It supports in-person events, which essentially are obviously we're having a meeting. It's this location on this date at this time. It's got a free text field that you can put in all the details, and you can choose to either have the RSVP method that they contact you directly, or you can link that through to your own registration page, where obviously you can manage those RSVPs. Obviously the contact person is there. What the system is doing with these events is basically every Monday morning, it takes a scan of what's coming up in the next couple of weeks. It aggregates it across an email and sends it out in a geo-targeted fashion. So, for example, the events that are occurring on the north side of Sydney, if I'm a GP, I get the email. It basically says these are all the activities that are happening this particular week. If I'm in Townsville, the email looks different. We're seeing that it's really, really well adopted from the primary care side. We're also seeing that there's been quite a number of events that have been put into the system, and on average, people are really driving about an additional 5 to 10 registrations through that channel. So that's there and available to you. What's interesting, and essentially what we sort of see driving more, is really the online mode of the event. As I mentioned, there's about 200,000 appointments available on Rxtro. We also see that about 100,000 of them aren't utilised each year. And another way to express that is that there's basically about 3,500 doctors that are sitting out there have said they're available. If someone was paying to be there face to face, we would maintain for them. But fundamentally, through whatever reason, there was no one in attendance. This events mode, the online piece, this is obviously not geographically targeted like a face-to-face events. This is actually targeted based on time zone, structured around the availability. So what this system does is the online events are obviously included in that Monday email that goes out to everybody. But what they actually do is it actually also scans to see who's got availability. And whereas traditionally we would send an email in the morning saying this is the person that's coming in, these are the products they look after, essentially if that's all good, do nothing. What this will now do is when there's a vacancy, it will actually send out that online event for people as well. So the email is, unfortunately, nobody's booked in a face-to-face capacity today, but there's this online event occurring. If you've got time and you're interested, obviously log in and see if there's anything there that's worthy of an update. This one is actually going very, very well. So as I mentioned, 3,500 doctors out there said they're available, no one in attendance. What we're typically seeing at the moment is that this is resulting in about an extra 15 to 20 registrations, which I see it as huge potential to grow because fundamentally 15 to 20 out of 3,500 is a very, very low conversion rate. As this grows with more regular high quality content, I see that there's potential to probably convert more like 5 or 10% of those particular doctors. So 100 people on a webinar at a lunchtime call, real opportunity for obviously high quality content. The other innovative ways that I've really seen this being utilised as we've been talking to companies, we're seeing that companies in certain circumstances have set up recurring events, and this might be an MSL or a medical person who's essentially said, we're going to make 12 o'clock to 2 o'clock available every Friday. And these are just drop-in sessions where a GP can actually just go, yes, actually, I did have a question related to that. I've got 5 minutes, I'm going to log on and I'm going to ask this. We're seeing that, yeah, basically around that sort of 5 per week are coming into different occurrences like that. So yeah, obviously working very, very well. So as I say, that's obviously an overview of how the content goes in there. September 1st, the content will be able to be tied to the specific appointment times. Just going back to this piece. So obviously September 1st, as I was just showing you, the content will be able to be tied to the specific appointment times. What will then happen is we'll start to work on the display to clinics. So this is what is going to be delivered in September. So from a clinic side, it'll all be revamped. Essentially, they'll have a really key overview of obviously who's coming and any practitioners and any meetings that are occurring. And then obviously they've got a full comprehensive record of that attendance. Finally, what we're doing, so once we've completed that in September, we're moving to obviously enabling the clinic to change the types of slots that they're making available. So firstly, what we're doing is obviously focusing on the channels that they're open to. So is it strictly in person? Are they open to a remote-based meeting, or is there no preference around that? And then fundamentally, requirements around the different meeting preferences. So is this a situation where we're happy to make this time available, but it's for programs only? We're happy to make this particular time available. The doctors have said it needs to be a new product or a new indication or so forth. Or we're happy to make this time available and it's for specialist meet and greets. So as I say, this is really phase one. Phase two and phase three are obviously the clinic side changes. So hopefully through this, what we see is that obviously the availability grows, the opportunity grows, and obviously the great solutions that are out there and available for patients are obviously able to be adopted. We've got a few minutes. Happy to open up to questions if there's any. There's a Q&A section down the bottom. So if anybody's got any questions, happy to take any. I'll give it a few minutes, and then yeah, if there's nothing, we can leave it there. Hopefully it all goes very smoothly. We've done a lot of work to try and make this as smooth as possible. Got one person with hand up. I haven't actually had the hand up one before, so I'll click this, and Carly, I think this will work. So let's see if it works. Carly, I think you can speak now.
Oh, okay, cool. Thank you. It just said the chat is disabled on the webinar chat, so no, you can't write anything.
Oh,
so if someone
crikey.
write, they probably can't. So
Thanks for that. I didn't realise.
And I was just going to ask, like, access-wise, do GPs access this directly, or is this something that their receptionists sort of deal with?
A bit of a combination. So what we see is obviously, look, from the setting up the times and managing the schedules, that's primarily something that falls into the administrative function of the practice. So they're generally kind of the owner of the account. There is the ability for the GP to register and tie themselves to that account. And we see that about 1,000 at the moment have done that. What we're really focused on is obviously how do we grow that? And this is where, as I say, the work that we're doing that's coming in November is really specifically aimed at functionality for the GP. So as I say, there'll be the ability to actually refer a patient through it and book in a slot. I'll provide some further updates in November. But yeah, we certainly see that. How do we grow that? But there is an appetite and there is the functionality there. Does that make sense?
Yeah. Yeah, cool. No, that's great. Thank you. Appreciate your help with the updated system. It's really good.
Fantastic, fantastic. Excellent. So look, apologies about the configuration, guys, in terms of the, I didn't realise that the chat has been disabled. If anybody else wants to raise their hand, I can obviously open up the microphone to talk. Alternatively, what I can do is obviously we can take questions after the webinar and obviously communicate that back out afterwards. So I'll give it another 30 seconds if anybody wants to put up their hand. Otherwise, we can leave it there. Fantastic. All right, guys. Well, look, thank you very much. As I say, they're the updates that are coming. The plan is to make it as smooth as possible for you and your teams. That's our goal. Hopefully it all goes that way. If it doesn't, I'm sure you guys will be telling us very, very quickly, and we'll have to be working quickly behind the scenes. Thank you very much. We'll speak to you soon. Bye-bye.